The following is a community affairs presentation from the Ulster County Health Department. This is the Healthy Ulster Radio Show, a weekly presentation exploring community health and sustainability with guests representing a broad spectrum of community partners working to make Ulster County the healthiest in New York State. This program is sponsored by the Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network.
Good morning. You are listening to Healthy Ulster Radio. I am your host, Dr. Carol Smith, Commissioner of Health and Mental Health for Ulster County. Joining me this morning is my co-host, Vin Martello, our Director of Community Health Relations. Good morning, Vin.
Good morning, Dr. Smith. And our listeners by now, I'm sure, know that we talk to a lot of professionals and experts throughout our community, and even individual citizens who are working in various aspects of community wellness and sustainability. And today, our topic is one that's critically important, not only to our community, but across the nation, and that is substance abuse prevention. And with us is our special guest, someone who I've known for and worked with for many years. I sit on her board, and her name is Cheryl DePaolo. She's a wonderful, knowledgeable individual, leader really, who's doing some amazing work out there with her team. Cheryl has worked in the substance abuse field for 34 years in outpatient, inpatient, and long-term residential treatment settings. She has worked in substance abuse prevention for 15 years and has been the director of the Ulster Prevention Council for 5 years. She is also an adjunct professor of psychology at SUNY Westchester and is an experienced community organizer and educator. Welcome, Cheryl. How are you today?
Hi, thanks for having me.
Yeah, our pleasure. And Cheryl, tell us a little bit about Ulster Prevention Council. How and when did it come into being, and what is its mission?
The council was actually a project of the Ulster County Legislature. The Substance Abuse Prevention Board was established by the legislature in 2006. And the reason for forming that board was to plan for, fund, coordinate, and evaluate substance abuse prevention services in Ulster County in order to ensure that programs were responsive to the identified needs and problems in the county.
I think at the time there were something like 26 different entities in Ulster County working on various aspects of substance abuse prevention. So I think the impetus was to really coordinate and integrate that effort so that we really could produce more effective results.
You know, we certainly know that we have substance abuse issues in our county, and we're actively trying to do something about that issue. Can you just talk a little bit more about what are some of the trends and emerging threats, and with the youth behavioral survey that we conduct every couple of years, what are we seeing among the youth?
Yes, we do survey youth every 2 years, and we have trends going back almost 10 years now. And we're really able to get on top of things that are developing because of the data that we get from thousands of students. So one of the really interesting things that's happening right now is internet sales, and especially internet sales of powdered alcohol. And that came up on the survey. I had no idea that that would be something that was going on, to be so easy to get, alcohol in an envelope directed to the house. We're also seeing stronger forms of cannabis. So the THC level that's in some of the new products made from hash oil are very dangerous and becoming more prevalent. And I think that the biggest problem that we have with cannabis is our survey shows that youth perception of the risk from cannabis goes down every year. So where all of our students across 7th through 12th grades stay right about 92% of them think that tobacco is dangerous, and that does not change. But for cannabis, it goes down every year to the point where only 20% of seniors are feeling that cannabis is harmful. So we look at messaging in order to increase the knowledge about harm. And it was also the survey that really pointed to the prescription drug use of our youth. We all know about prescription drug use and heroin overdoses with adults, but the fact that our children were using them more and more was really of concern, and so we acted quickly to address that.
That's a real critical one, right? Because we know that 70% of heroin addiction started with prescription drug abuse, and an overwhelming majority of drugs out in the streets, highly addictive opioid painkillers, and which can lead to heroin, come right from our own medicine cabinets, right?
Absolutely. And, we get these drugs from doctors for you have an injury or surgery. And so, they're in the house. And we were taught for years that these were great medications that did not cause addiction. However, they're really, it's pretty easy to become addicted to them once you've taken them for a little while. And one of our big pushes that we do throughout the county is just trying to get people to let go of those medications and to dispose of medications that you're either not going to use or you didn't need all of it. Sometimes someone dies and leaves a great deal of medication behind. And all of those substances are ripe for abuse, not just by youth, by anybody that really could come into the house. And also, we're preventing a means to suicide at times by getting those medications out. And so we're able to really look at reducing the rates through doing that, and also keeping our water supply safe, because a lot of people say, I flushed them. Not to flush them. It's really not a good idea because of the water supply.
And I know we've worked very, very closely with setting up, with the county executive and local law enforcement, setting up medication collection boxes throughout the county. I think we have about 19 of them, more than any other county in New York State. They're in police departments currently because that's what the law said in terms of they had to be under law enforcement jurisdiction. But people can bring their unused medications there, no questions asked, anonymously, confidentially. You can either just pour the pills right out of the bottle and take the bottles back with you, or rip off the labels and put them in. But it's really, really important, folks. Get those medications out of your medicine cabinets, safely dispose of them, because what happens is they get onto the streets, they get into the wrong hands, they get with our youth who abuse them either intentionally or not, and then we know the damage that ensues.
Certainly these drop boxes are, as you say, the individual can go right to the box and discard that unused pharmaceutical container, what have you, of pills right into the box. It's sort of like going to the post office or putting something in a mailbox. It doesn't really involve the interaction of the law enforcement at all. So folks should not feel in any way inhibited about doing that.
Right. They're really not looking at what's going in. And what happens when they open the box, and believe me, the machine is full when they open it. Everything comes kind of tumbling out, but it's just boxed up as evidence. They're not really looking at what's there. And when police evidence is taken to the incinerator, they take that with them. It's weighed. We know that we have collected thousands of pounds of medication, which is interesting when you think about a bottle of pills and the little noise that it makes and how light it is. To have thousands of pounds out of cabinets has really been an incredible feat.
I know I've heard talk. I've never witnessed it in person, obviously, but I've heard talk of teenagers going to parties where each person brings something they've gotten from their parents' medicine cabinets, pouring it into a punch bowl, stirring it up, and each kid taking a handful of God knows what combinations of drugs, and that are just an awful scenario.
Right, and they've even kind of kicked that up a notch, and now they use the internet or a book to identify the drug. So they're looking at the pills, looking up the numbers to see what they've got, and so it makes it a little bit more, interesting. It's a horrible thing to have that much available.
So it's almost like a game of whack-a-mole in the drug world. failed, right? Because we do public health education and law enforcement does their part, and we manage to reduce use of a certain drug, but then it pops up its ugly head in another form, or some other drug takes its place. So, Cheryl, how do you stay on top of all of that, and let alone educate parents and community about those dangers?
Well, I spend a lot of my time just finding out what's going on around the country, what the DEA is seeing, what trends are, just to kind of be that early warning system. And I think that there always will be a new thing. It's the nature of not only adolescence, where
supply and demand, right?
Supply and demand. And, youth see risky behaviors like that. Instead of being afraid like adults would, they feel that kind of more as excitement than fear to participate in a risky behavior. And so that's why it's up to us adults to protect them from their own impulsiveness.
I think drugs are really pervasive in our culture too, right? Because we, between over-the-counter and prescription drugs, the companies are spending billions and billions of dollars every year in advertising, telling people that no matter what ails them, if they're depressed, if they can't sleep, if they can't, whatever it is, there's a drug for that, and as in there's an app for that. But the problem with that is that when you're pushing all of that information out there, that drugs are the answer to everything that bothers you or ails you, to me, it's no mystery that we have a substance abuse problem, because it's, especially with kids who don't necessarily have the developmental ability or the analytical ability to know the difference between what's really important in terms of, what role those play in real health prevention, healthcare, and just abuse, right? That's that line.
Right. We know that the last part of the brain to develop is where you really have good judgment. And so, that's where the drugs can also affect thinking. And what we know now that we hope will reduce some of the stigma around drug abuse is that when you take these drugs or alcohol, they really change the brain. And so it's not a matter of just, don't do that and you can stop. We know now, and it's really interesting to see the evidence that these drugs and alcohol change the very structure of the brain and the way that it works, and not just the behavior that we outwardly see from addiction. And so we're starting to look at it in a different way.
And we know that children and adolescents' brains are not fully developed. I think I attended one of your seminars, and you mentioned till about age 20, right? So prior to that time, the analytical, rational part of the brain that might deter them from doing that is not fully formed, and so they're really vulnerable. Is that correct?
That is, right.
And Cheryl, so in terms of Ulster Prevention Council, talk to us a little bit about the types of things that you do working with, say, community coalitions and in the school districts, the types of efforts and programs that you have your team has worked quite successfully on over the years.
Well, there's a real body of knowledge in prevention science now, and it's a public health model in the same way that we address other issues. And so we do public prevention education in the school districts, and there are model programs that have been proven to work in communities and in schools, and that's the most important service that we provide.
Mm-hmm. And are the schools really enthusiastic about, or are they grateful for that support, to have that resource available?
Oh, absolutely. Yes.
Mm-hmm.
They're very glad to have the service.
And I know there's some great coalitions too, like the Greater Community Partnership in New Paltz that are doing amazing work, the Route 212 Coalition, and others up in Woodstock, Saugerties.
Mm-hmm. The Ellenville-Wawarsing Coalition.
Mm-hmm.
Yeah.
Mm-hmm. Mm-hmm. Well, we're going to take a very short break, and we want to hear more about this important and fascinating topic. We'll be back right after these words with Healthy Ulster Radio.
The excitement continues to build. The mission of Health Alliance is now made even stronger by our new partnership with the Westchester Medical Center Health Network. By combining a legacy of community-based care with WMC Health, we are building a stronger, healthier, and more vibrant community. We'll be collaborating to provide preventive, primary, specialty, and advanced care right here where you live, where we all live. Health Alliance and WMC Health, advancing care here. Visit HAHV.org to learn more.
Welcome back. You are listening to Healthy Ulster Radio. Today, our guest is Cheryl DePaolo. Cheryl, could you tell us a little bit more about the new family advocate that your agency is hiring to provide services to the people of Ulster County?
Yes, we're really excited about this new service, the Family Advocate Program. Ulster County recognized that a lot of people need to get medical treatment in order to stop using, and especially with the opiate epidemic. And yet, health plans were not approving that treatment. And so people who were motivated to stop and wanting to stop and needing medical help were being prevented from getting that service. And so the Family Advocate is put in place to file insurance appeals when insurance plans are not doing what they're supposed to do according to the law. And also, it can be very confusing to figure out what services are available, what facilities. And so the advocate will just make it all very kind of plain and clear and spend as much time as is needed so that families understand the different avenues that will help them to get what they need.
It's got to be very difficult for a family, say, who discovers some kind of addiction, right? Because it is akin to a serious illness, right?
Absolutely.
And they really, even those of us who work in the system sometimes have a hard time wrapping our minds around and arms around everything that's out there. And then you get a family who's all of a sudden facing a crisis emergency situation, and the stress that goes along with that, and then trying to figure out, oh my God, what do I do next? Where do I go? How am I going to pay for this? So we know that prior to some of the changes in the law, there were a real shortage, not only a real shortage of recovery and rehabilitation facilities, but also some families came under extreme financial duress trying to find treatment for their loved ones. Is that not right?
Sure. Many families have spent their retirement savings on trying to get the right treatment for someone who's addicted. It is a life or death situation.
Mm-hmm. So this family advocate is somebody that's on the ground right here in Ulster County, right, in Kingston, who's going to be able to really just, you can make an appointment to see him or her, I guess, and then and have that person work side by side with you to help navigate your way through this maze of services and insurances.
Yes, and we're not even requiring somebody to walk into the office to use the service. Mm-hmm. We will have a dedicated phone line, and we'll return calls as quickly as we can. We do have a space in Ellenville, so we can spend time there when needed. And we will do what it takes to follow families through to the point where they're feeling supported. We're also doing linkages to peer supports, which are very important. There are many people who are really experiencing the wonders of being in recovery, and sharing that hope and partnering with people in that situation is a very nice component to what the advocate will be able to do.
That's always a terrific way of reaching out to people who are suffering from addiction. And I know that you have in some of your programs, you work directly with teens on media campaigns for discouraging substance abuse, and others. Can you tell us a little bit about that? I know the group out in Ellenville and Sauger Teens.
Yeah.
There's a program called Sauger Teens.
Sauger Teens is a group of youth that meet at the library with our community prevention specialist, Juanita Hotchkiss, and they were very anxious to get back after the summer and start to work on things. And so they serve as kind of a sounding board. They are are very interested in reaching their peers with positive messages. They're planning an event at the ice skating rink again this fall. And they will also be recording some of the public service announcements that we do. We use youth. We go into the high school studios, which produce excellent products that have been used to address many of the issues. And of course, having youth reach out is much better than anything that I would ever be able to say.
And wow, are they good? I mean, I had the honor of being a judge for the most recent media contest, and the submissions were just phenomenal. And I say that as a public health person and a longtime communications professional. These things were great. I mean, they were really great. And as you say, you know, kids talking to kids is a lot more powerful than adults talking to kids.
And they're all available on our YouTube channel, Ulster Prevention TV.
Mm-hmm. Mm-hmm. And Cheryl, we work together, and you know, substance abuse prevention truly is a community-wide effort, and it's something we always talk about in Healthy Ulster Radio, that we have to take a whole community approach to improving the health and wellness of a community. And one of the projects that all three of us here have worked on with others is to put on community substance abuse prevention forums throughout Ulster County. We did one most recently in New Paltz at BOCES. We were expecting something like 50 people. We had an overwhelming turnout. Over 250 people were there. We had a panel of experts. We had some 30 different providers, service providers. We had individuals and families who had gone through the addiction experience and had emerged from the other side, talking about that whole, which was tremendously powerful. And our very own Dr. Smith was the keynote presenter. Dr. Smith, tell us a little bit about what you talked about at those forums.
Well, I talked about the issue of opioids and how they go back in history, and certainly how they are impacting us now, including, the numbers of individuals impacted and the way it affects the human brain, and does, in fact, make changes to the brain, which then alter an individual's ability to make judgments, particularly about further opioid use. So, it's a complicated issue. It goes back a couple of thousand years, actually, to see different societies and civilizations that have been impacted by addiction to the opiates. It's an extremely powerful drug and a powerful addiction. But Cheryl, maybe you can tell us a little bit more about how do people get in touch with you, Family Services, the Ulster Prevention Council, if they want more information, if they want to know how to access your resources. What's the best way to do that?
There are a few different ways. I think the best is our website, ulsterpreventioncouncil.org. There you will find links to all of the coalitions, all of the media we do, as well as a weekly blog. And we also have a Facebook that's very active, Ulster Prevention Council on Facebook, and our YouTube channel, Ulster Prevention TV. I can be reached directly. I take calls all the time, 458-7462. That is Cheryl DePaolo, the director of the Ulster Prevention Council, and you can call me at any time.
And we also have, by the way, on our county websites at the Ulster County Health Department, we have a whole section on substance abuse prevention with a lot of different resources there. We are currently working on a comprehensive and integrated resource directory guide. We haven't decided whether we're going to put it into a mobile app form or a website that is mobile optimized so that people can access it from anywhere. But on the note of the community forums, we know that we have another one coming up in Ellenville on October 19th. It starts at 5:30. At the Ellenville Elementary School. And again, Dr. Smith will be delivering her terrific. I mean, if you really want to understand the this issue from really its start all the way through to the present, and why things are happening the way they are now, it's a terrific presentation. It's really, really, really fabulous. And also to hear, from law enforcement, educators, parents, families, individuals who suffered through addiction, and then after all of that, to be able to go to the dozens of service providers, really all of the key players in Ulster County and surroundings, right there, and talk to them, get information, get their literature, maybe make an appointment if you'd like, to get more information, and then also to listen to and then also have the opportunity to ask questions of the panel. It really is a terrific opportunity. As I said last time, we got a tremendous turnout because our community, everybody is aware of the substance abuse challenge. Cheryl, you live it every day. So are there any other programs or events that you'd like to talk about that maybe we might have not touched on?
Sure. I would just like to send out, Superintendent Kevin Castle in Wallkill has really been responsible for putting those forums together. And so I just want to acknowledge his leadership. We do have coming up a little bit of a different kind of event, and it's going to be on October 31st at the Ramada in Fishkill. And that is a policy summit. And so we're inviting local and county government, anybody in leadership to that summit. And it will be a breakfast with Congressman Maloney and Gibson, as well as Chauncey Parker, who's the director of the New York, New Jersey high-intensity drug trafficking area, and he'll be able to speak about their efforts. So we're excited to see what will come of that.
And that's really great. Tell us your website and phone number again, just so that we can remind listeners.
Sure. UlsterPreventionCouncil.org, and the phone number is 845-458-7462.
Well, unfortunately, that's just about all the time we have for today, although this is a fascinating subject and one that demands everyone's attention and proactive involvement, from parents to educators to everyone. Everyone in this community has a role to play in preventing substance abuse. So thank you, Cheryl DePaolo. It's a pleasure working with you and to have you as our guest today.
Thank you.
You will come back and join us again at another time.
Yes, and you're listening to Healthy Ulster Radio. If you have any comments, questions, or if you want to know more information about this topic or others, send an email to healthyulsterradio@gmail.com. And please tune in next week for more great information that you can use to keep yourself, your family, and your community healthy and strong. Thank you.
You've been listening to the Healthy Ulster Radio Show, a community affairs presentation from the Ulster County Health Department, sponsored by Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network. Thanks for listening, and be sure to join us for another edition of the Healthy Ulster Radio Show next week.